Hello, my name is Jeff. I'm a student nurse at Duquesne, and I'm going to be doing an abdominal assessment on you today. Alright. Alright, now have you lay down.
Okay.
You'll show the abdomen. Alright, first, I will be inspecting to see shape, size, contour. Okay? Everything looks fine.
Okay.
Next, I'm going to auscultate, which is listening through my stethoscope.
Alright.
I'll start in the right lower quadrant.
Alright.
You have bowel sounds in all of your quadrants.
Thank you.
So far, so good. Next, I will percuss and try and find your organs. Seems the border of your liver is right here.
Okay.
Alright, everything seems to be in order.
Okay.
Now, I'm going to palpate your abdomen.
Okay.
First with light palpation, so tell me if you feel any pain or tenderness.
I'm good.
Okay, next we will go with deep palpation.
Okay.
Any pain or tenderness
Nope.
at all?
Nope.
Okay. That is the assessment of a regular abdomen.
Afternoon. My name is Greg. I'm going to be your nurse today.
Hi, Greg.
What seems to be the problem?
I've just been having a burning in my upper stomach, and I've been vomiting a lot in the last few days.
Okay. So you said it was a burning pain in your upper abdomen. Have you had any nausea? Any vomiting?
Oh, yeah.
Okay. Alright, why don't we do an abdominal assessment? Okay, now that I've finished auscultating all 4 of your abdominal quadrants, I'm going to palpate. Just let me know if anything hurts.
Okay. It hurts up there.
It hurts here?
Yeah.
Okay. So it just hurt up here?
Yeah.
Okay.
Good.
Okay. Right, now that we finished your abdominal assessment, I just have a couple follow-up questions for you. Okay. Have you recently had any kind of bacterial infection?
No.
Okay. Do you use pain relievers on a regular basis?
No, not that often.
Okay. How much do you say you drink?
Not very often.
Okay.
Time for my pills. Time for my pills.
So since you had nausea and vomiting and upper abdominal pain, we determined that you have gastritis.
What is that?
Gastritis is inflammation of the stomach lining, which can occur acutely or chronically.
Well, can I get rid of it?
Well, first, to make sure, there's a couple additional tests we have to do. We have to test for H. pylori. We can do an endoscopy or an X-ray of the digestive system. And then once we do that, we can determine if you need an antibiotic medication to kill the H. pylori or medication that blocks acid production to promote healing. Medication can also reduce acid production, and antacids can neutralize the stomach acid. There's also a couple lifestyle remedies I might recommend. Eating smaller, more frequent meals, avoid irritating foods, avoid alcohol,
What?
Okay. Switch pain relievers and manage stress.
Okay.
All right, to recap gastritis, it is the inflammation of the lining of the stomach. It can occur acutely and be sudden, or it can take a longer time and be chronic. Some symptoms are a gnawing, burning, ache in the upper abdomen. It will also feel a sense of fullness after eating meals, will vomit, and have nausea. Causes is the weakness in the mucus lining that protects your stomach, will allow the digestive juices to damage and inflame your stomach lining. Some risk factors for gastritis are bacterial infections, the regular use of pain relievers, old age, excessive alcohol use, autoimmune gastritis, other diseases such as HIV, AIDS, Crohn's, and a parasitic infection. Some test diagnosis to find out if your patient has gastritis is you can test for H. pylori, an endoscopy, and an x-ray of the upper digestive system. Some treatments are medications and antibiotics to kill the H. pylori. Also a medication that will block acid production and promote healing. There's also antacids, which will neutralize your stomach acid. Some lifestyle remedies and changes a patient can take to reduce the chance of getting gastritis would be to eat smaller, more frequent meals, avoid irritating foods, avoid alcohol, switch pain relievers, and manage stress. And that is gastritis.